All pregnant people in Ontario are now eligible to receive a COVID-19 vaccination. That's after Toronto hospitals reported an alarming number of pregnant patients. The move comes as the province grapples with the worst of this pandemic. Dr. Isaac Bogoch is an infectious disease physician and a member of Ontario's COVID-19 vaccine distribution task force. He joins us from Toronto. Doctor, welcome back to the show.
Well, my pleasure. Thanks for having me back.
So I want to start with this prioritization. You called this, for pregnancy, a really good move. Why is it so important to do this?
There's a few reasons. One, we know that pregnant individuals are more vulnerable. I mean, they are more susceptible to severe outcomes of COVID-19. That's pretty clear. You know, you could say that's the same for lots of people, and that would be true. I think there's an additional ethical and moral obligation that we have to protect pregnant individuals and of course the unborn children. Certainly we're seeing a growing number of cases in Toronto hospitals and hospitals in Ontario and around Canada. There's some very sad cases in the ICU. I mean, just to get technical and maybe too much information, but you know, there's cases of emergency C-sections in the ICU to help the pregnant individual with their breathing. And you know what? This is all preventable. If we enable people to have access to vaccines, enable them to have the choice to have a vaccine, a lot of this could be prevented.
You know, that's one of the many challenges that the Ontario health system is dealing with. Another now is the emergence of these variants first identified in India. And we've seen the ban on flights from India and Pakistan for the next 30 days. But when you look at the numbers, there's 42 cases of this variant identified in British Columbia, 1 in Quebec, 1 in Alberta. And now we're being told 36 in Ontario, all directly related to travel. I mean, variants are concerning. What do we know about this variant? How worried should people be?
We actually don't know too much about this variant. We know what mutations it has. We've seen these mutations in other variants. And I don't think it would come to anyone's surprise when the dust settles. We'll probably see that this variant is more transmissible compared to the COVID-19 that we had in Canada initially. It may, you know, some of these are unanswered questions, though, like to what extent does this cause more significant or severe symptoms? Unknown. To what extent can this help reinfect somebody if they are recovering from a COVID-19 infection? Unknown. To what extent do the vaccines provide significant protection against this variant? Unknown. But it's likely that the vaccines still provide some protection. So, I mean, yes, lots of unknown questions. And in the context of unknown and a potentially some potential public health threat, I think it's appropriate to proceed with caution.
Right, and we should note this is a variant of interest at this point as opposed to a variant of concern. But, you know, all of them are of concern, of course, because all COVID is dangerous. And as sort of focus a little bit on Ontario, and if we can, I'd like to try to end with a bit of hope, right? I mean, Ontario's in the midst of its worst wave so far when you look at where hospitalizations are and the ICU bed capacity being overwhelmed. But we did see the modeling today from Dr. Theresa Tam and Dr. Howard New, and that the R rate, the rate of transmission nationally, has bent down. It is below 1 for the first time in a while. We look at the pace of vaccines coming in. Next week will be close to 2 million, and then a minimum of 2 million every week after that. Dr. Tam suggested the modeling says, look, if we keep going and get to the 75% first shot, 20% second shot, maybe in July, maybe in August, we can start lifting some of these restrictions. I mean, when you look at all the data, and I know there's still urgent concern in Ontario, are we looking at what might be the beginning of the end?
I think it's the end of the beginning, but yeah, the short term is tough. In most places in Canada, we know there's going to be a couple of tough weeks ahead, for sure. You can't deny that. But the midterm and the long-term future actually look really good, right? The vaccines work. We're vaccinating faster than we've ever vaccinated before. We're getting access to more vaccines, and we haven't even met our full capacity of the pace of vaccination that we can do in Canada. R is below 1. Even though we're in some provinces where we're seeing astronomical rates of COVID-19, it looks like it's actually plateauing. We might have peaked. So there are big arrows pointing in the right direction. Having said that, we're not out of the woods yet, right? Even if we have to come down that side of the mountain, in Ontario, for example, you still have to digest 4,000, then 3,000, then 2,000, then 1,000 new cases per day. That's a lot for your healthcare system to absorb. But at least you're headed in the right direction. So I think we are starting to see those arrows point in the right direction. Midterm and long-term forecasts look good. It's going to be a tough few weeks ahead for sure.
Yeah, and even if, say, Ontario, for example, can hold its ICU capacity to 1,000, which was sort of the worst case, it's still going to take months and months for those numbers to go down, right? Because once people go in, they tend to stay for a long time. So you know, looking at what's in front of us and the measures that are in place and the vaccines that are coming, what do you think summer could look like in this province?
It's, short-term projections are easy. Longer-term projections are so challenging. So for starters, the caveat is don't hold my feet to the fire if I get this wrong. Having said that, I have a feeling that if things go okay, if there's no, all the caveats, the vaccines keep rolling in, blah, blah, blah. I think that, summer 2021 could look better than summer of 2020. It's probably not going to be the summer of 2019, but it's probably going to be better than the summer of 2020 based on our pace of vaccination and that will likely come out of this third wave, in the next few weeks.
Okay, well, we'll try to leave it there and a little bit of hope as we come to an end of another week. Dr. Isaac Bogoch, thank you so much for your time.
My pleasure. Have a great day.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.